Hi there, I'm Aurora Allen, and I'm a student at Westminster, and this is my research into genetic counseling. I'm interested in this field because it's an intersection between biology and the medical field. It also has many important nuances that I thought were worth considering before attempting to apply to a master's degree or further my education toward the field of genetic counseling. Dr. Bonnie Baxter and I have compiled this meta-analysis to consider the nuances behind the field of genetic counseling, and to help students consider them as well. Before continuing through the rest of the presentation, there are a few terms I find important to define. The first term is genetic counselor, and the definition we'll be using for this presentation is a healthcare professional who has received graduate education and training in medical genetics and counseling. Genetic counselors inform and advise individuals and families on their risk for inheriting certain diseases and the treatment options available. The second term I'd like to define for this presentation is non-directive counseling, which is a type of counseling in which the counselor refrains from interpretation or explanation, but encourages the client to talk freely. The third term is dysgenics, which is defined as, for this presentation's sake, the study of factors producing the accumulation and perpetuation of defective or disadvantageous genes and traits in offspring of a particular population or species. The last term I'd like to define for this presentation is ableism. Ableism is a set of beliefs or practices that devalue and discriminate against people with physical, intellectual, or psychiatric disabilities, and often rests on the assumption that disabled people need to be fixed in one form or the other. Now that those important terms are defined, I'll give a brief overview of what we'll be covering in the rest of this presentation. Firstly, I will address how genetic counseling is related to medicine and genetics. Then I will address how to approach the field of genetic counseling as someone who wants to become a genetic counselor. And the topics I will be addressing within that category are where you can go to school, what programs are available in the United States, and some reputable programs that I have looked into so far. After, I will address common concerns with the field of genetics, and genetic counseling in particular, such as morality concerns, personal difficulties, differing beliefs, politics and liability, ableism, and accessibility. Grace Newick, a writer for the Jackson Laboratory, said that genetic counselors are trained to see the human side of genetics and help people understand the medical, psychological, and research implications of genetic contributions to disease. I think this quote sums up genetic counseling pretty well, because genetic counselors need to have an understanding of both genetics and medical laboratory work. They work closely with a wide variety of medical professionals to ensure their patients get the best treatment possible for their unique situation. Genetic counselors use a non-directive approach to counseling, which is defined previously, to allow for each individual patient to make decisions without the opinions of the genetic counselor influencing them. The purpose of genetic counseling is to educate individuals about genetics and allow each individual to make an informed decision about their own genetics. Often the individual is put into contact with a medical professional who can further help them after coming to a decision. There are many different specialty areas within the field of genetic counseling. When most people think of genetic counseling, they assume prenatal genetic counseling, which is when an individual or individuals seek out a genetic counselor to learn about their genetic predisposition for offspring to have any genetic differences that may or may not be life-threatening or otherwise. Although prenatal genetic counseling is a plurality of 35% of the genetic counseling specialties that people seek out frequently, it is not a majority. There are many other specialties that are equally as important, including cancer genetic counseling, pediatric genetic counseling, and many other specialties. Genetic counseling is a very flexible field and has many different specialties for any student to go into. Approaching a field like genetic counseling with so many differences and with such versatility and variability can be daunting to any student, so I'm here to supply you with some facts It should hopefully make approaching the field of genetic counseling as a student easier. There are a few prerequisites to take into consideration when applying for a master's program in genetic counseling. Common prerequisites for master's programs are a 3.0 GPA and a GRE score above the 50th percentile. Oftentimes programs have program-specific prerequisites as well, such as biochemistry or psychology. So if you're looking into a specific program at a specific university, make sure to check its specific class prerequisites because oftentimes they're different per program. There are many requirements to graduating with a master's degree in genetic counseling, and the requirements vary depending on the program that you choose. However, there are some universal requirements, such as most master's degrees are about 2-year programs in genetic counseling, as well as they require you to take extensive coursework, often including biochemistry, psychology courses, genetics courses, and counseling courses. Oftentimes it also includes lab exposure, as well as exposure to various fields of genetic counseling. There are upwards of 40 universities with genetics counseling programs, but some of the more reputable that I've found in my research are Northwestern University, Johns Hopkins University, and the University of Utah. Links are included in the citations if you want to do some research on which programs are best for you if you're considering this as a career option. The programs of these universities are designed to focus on student wellness as well as focus on an education of diversity, equity, and inclusion to ensure a well-rounded genetic counselor with the correct mindset for genetic counseling. Their curriculums are designed to prepare students for every discipline under genetic counseling and every environment. Often rotations or exposure into differing genetic counseling fields are required, such as fields like prenatal genetic counseling, pediatric genetic counseling, and cancer genetic counseling, as well as other clinical specialties. Hopefully you have a decent understanding about how to approach a master's degree in genetic counseling now. I'm going to move on into the part of the presentation where we'll be considering the moral nuances and other important considerations of genetic counseling that I think are important to understand before going into a degree in genetic counseling. There are individuals who find moral quandaries with genetic counseling for various reasons. Such concerns have many sources that will be discussed later on in this PowerPoint. Often these concerns are personal, based in concern for the well-being of others, or fear-based. The purpose of genetic counseling is solely to provide education and not to persuade individuals into decisions they are uncomfortable with. That would be a form of dysgenic counseling practice. It's not how genetic counselors get counsel. So the job of a genetic counselor is to make patients feel at ease, to provide them with the education to alleviate fears surrounding genetics and genetic counseling so that moral quandaries are put at ease. There are various personal difficulties associated with genetic counseling because one's genetic information is an incredibly personal thing, and finding out there are genetic differences that could lead to genetic conditions in offspring or even in oneself, such as in cancer genetic counseling, can be a painful experience for patients and for genetic counselors alike to be the one relaying such information. So in this field, just like any other form of counseling, it's very important to keep a good patient-counselor relationship so that it's easier for the personal difficulties of both the counselor and the patient. Differing beliefs are another important nuance to consider when thinking about genetic counseling. The article, Genetic Counselors' Religiosity and Spirituality, Are Genetic Counselors Different from the General Population?, stated, although 95% of genetic counselors felt that their personal beliefs did not affect their ability to remain non-directive within the counseling session, 64% of genetic counselors felt that there were situations that conflicted with their religious convictions. This same study came to the conclusion that in the Midwest, the percentage of patients who received genetic counseling who perceived her spirituality to be relevant to genetic session was 22.5%. Therefore, there is evidence to suggest that the religious beliefs of genetic counselors can induce internal conflict in at least some genetic counseling scenarios, but research on the religiosity of genetic counselors is limited nonetheless. Since the job of a genetic counselor is to provide unbiased education and non-directive counseling, this means that whatever a patient chooses as the correct treatment option for them, the genetic counselor's only job is to provide treatment options and education on what their individual's genetics means. It does not mean that the genetic counselor gets any say in what treatment options the individual chooses. This means that in prenatal genetic counseling, there is a chance that treatment options could include termination of a pregnancy, adoption after the pregnancy has come to full term, or other family planning options. Or in cancer genetic counseling, this could mean cancer treatment or choosing not to be treated. And whichever choice the patient makes is up to the patient and should not be determined by the genetic counselor. The genetic counseling profession is 50 years old now, and it is growing and diversifying constantly. According to the article, I Am a Genetic Counselor, Qualitative Exploration of Field Leaders' Perceptions on the Title Genetic Counselor, this study researched how the community leaders thought of genetic counseling as a field. The participants' perceptions of the title genetic counselor had various themes. One quote from this article stated, "The counselor component of the title genetic counselor was a topic of focus in the interviews. It was simultaneously associated with both pride and a certain sense of stigma or discomfort. Especially, on the one hand, many participants often reflected that, to them, the term counselor captures the unique value of genetic counselors and sets us apart from many other types of healthcare professionals." This article talks about how community leaders perceive the term counselor and how communities perceive genetic counselors as a whole. And it focuses on the term counselor and what emotions are evoked from that term in various communities. It is also important to consider the liability of genetic counselors in the legal system. According to the article, Father and Mother Know Best, defining the liability of physicians for inadequate genetic counseling, increasing information on genetics has influenced how parents perceive pregnancies. When this information is available either before conception or during pregnancy, prospective parents may choose to prevent pregnancy or abort. There have been recent incidents where the courts have been called to define when parents or children should receive tort damages when parents are prevented, either intentionally or unintentionally. Opportunities to prevent the birth of children with genetic abnormalities from physicians and genetic counselors, failure to detect or disclose risks of genetic disorder. There has been judicial reluctance to approve abortion undertaken to avoid the birth of children with genetic abnormalities is becoming less and less justified. New judicial willingness to recognize some physician liability for failure to give accurate genetic risk information has not been consistent. Even cases in which liability has gone through the court, types and measures of damages have been inconsistent. This study goes on to suggest changes in regulations, including proposing a set of requirements and principles for upholding and determining the measure of damages from negligent genetic counseling by physicians and genetic counselors, so I highly recommend that you give this article a read if you're interested in pursuing genetic counselors, because it explains how genetic counselors can act to make sure that they are not being non-directive in their counseling practices, as well as avoiding dysgenics and what legal protections there are for parents, as well as what legal protections there are for genetic counselors. Ableism, as defined previously, is prevalent in the field of genetic counseling because genetic counseling deals with topics such as genetic differences, which have certain stigmas around them to some people. Ableism can be imparted in forms such as microaggressions, which are brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative attitudes towards stigmatized or culturally marginalized groups. They also can include imparting internalized ableism on those with genetic differences or disabilities. Internalized ableism occurs when a disabled person believes that they are less worthy due to their disability and act accordingly. And it can be caused by others imparting notions of encumbrance or feelings of inadequacy on people with said disabilities. Since genetic counseling deals with genetic differences and disabilities and the possibility of having a child with genetic disabilities or trying to learn about your own genetic disabilities or differences, it's very important to take into consideration any ableist tendencies as a genetic counselor that you have, because it's very important to try to avoid notions of encumbrance or impart any ableist ideas on prospective parents, as well as avoid causing unnecessary pain for those with genetic disabilities or differences. Therefore, if you become a genetic counselor, it is your responsibility to continuously educate yourself on ableism, as well as continuously attempt to improve the language that you use as a genetic counselor to be more inclusive. Language as a genetic counselor is highly important, and it's increasingly important if you consider reflecting on the ableist tendencies. So it's very important to stay up to date on common misconceptions and be constantly correcting yourself as a genetic counselor on how to better communicate with patients about genetics. Some common misconceptions are listed on this slide. I implore you to take a look. If you're curious, there are more included in the citations. You can follow the citation there, and it'll take you to more misconceptions as well as more research about the concept of language and miscommunications and misconceptions surrounding genetics and genetic counseling. Genetic counseling accessibility is a large concern in the field currently because oftentimes there are too few genetic counselors for the population of people who would like access to genetic counseling. There are various reasons for this, including healthcare and the amount of genetic counselors available of each type. Oftentimes there are people who have to travel across states just for access to the type of genetic counselor that they seek. Healthcare access is one of the major concerns on accessibility for genetic counseling. Healthcare is often a requirement for genetic counseling because it can be rather expensive to seek such services. Since minority communities are disproportionately affected by having no healthcare, then they are less likely to seek genetic counseling, which means the clientele is less diverse, and the genetic counseling field can be fairly elitist. It's important to consider how we can broaden our perspective and how healthcare plays an impact in access to genetic counseling, and how expanding healthcare may increase access to genetic counseling for minority groups. One way to increase accessibility in the field of genetic counseling is expansion of the field. Since this is a growing field, new genetic counselors are needed all of the time to fill all of the new roles available in genetic counseling. Genetic counselors are desperately needed in rural towns as well as in larger cities so that minority communities have better access to genetic counselors. The heart of genetic counseling really is education, so that's where you come in. If you do choose to pursue the career of genetic counseling, then consider all of the diverse options and consider all of the diverse communities who can use genetic education to better understand themselves, their communities, their loved ones, and their children. Thank you so much for listening to my presentation on my semester-long research into the field of genetic counseling. I hope you'll take a few minutes to email me any questions that you might have, or send me a text with any questions you might have. My email and phone number are provided on the slide shown, so take a few minutes to ask me any questions and I will get back to you just as soon as I can. Here's the first of my citation pages. Feel free to pause and look longer if you'd like. And here is the second, list of all of the sites that I have used for the information provided to you in this presentation.